Good morning to those in our viewing audience. My name is Quentina Miller-Fields. I am the Director of Student Affairs for the Savannah-Chatham County Public School System. This morning, I have a few of our school social workers who will be joining me, and we'll be talking to you about some things that you can do at home. We have live demonstrations, and then we have some very important information. While our school district may be closed, our ears to you are not. So whatever your concerns are, whatever your needs are, you can always call our office at 912-395-5584. Again, our number is 912-395-5584. We are here to help our families. We want to remove any barriers that will have an impact on academic attainment. We also want to give you some helpful tools that you can use while you are home with your families. We want our students to still learn remotely, and our parents to feel that they can still access resources. All of our school social workers are housed on the umbrella of the Student Affairs Department. So again, while our schools may be closed, our ears are open to you. We serve as a liaison between our students, our families, and the available community resources. So please do not hesitate to call us. We will make sure that we do our very best to provide you with any available services that you may be in need of. So now, with a live demonstration, things that you can do at home, parents, with your child can do to protect himself and protect others. We have school social worker Leslie Walker. I'm going to pass the mic over to Ms. Walker. Ms. Walker.
Good morning. I'm going to talk a little bit about the coronavirus and what the Center for Disease and Control and Prevention says, how to protect yourself. So how does the virus spread? There is currently no vaccine to prevent the coronavirus disease, so the best way to prevent the illness is to avoid being exposed to the virus. The virus is thought to be spread mainly from person to person, between people who are in close contact with one another, through respiratory droplets produced when an infected person coughs or sneezes, and these droplets can land either in your mouth or your nose, which can be inhaled and possibly land in your lungs. So how do we take steps to protect ourselves? Number one, making sure that you're cleaning your hands as often as possible. So the CDC recommends that you wash your hands often with soap and water for at least 20 seconds, especially after you've been in public places or after you've been blowing your nose, coughing, or sneezing. If soap and water is not readily available, CDC recommends that you use a hand sanitizer that contains at least 60% alcohol, and that you cover all surfaces of your hands and rub them together until they feel dry. CDC also recommends that you avoid touching your eyes, nose, and mouth with unwashed hands. So how do we avoid close contact? The CDC recommends that you stay away from people who may be sick or who are thought to have been infected with the coronavirus. By putting distance between yourself, as the mayor has already stated, that we are under an order where we're practicing social distancing, which means that we're to be 6 feet apart from any person. And then also the CDC is recommending that if you just have to go out into the community, that it's especially important if you're high risk and or if you're sick, that you practice that social distancing, meaning that you are 6 feet apart from the next person. Also, the CDC recommends that you stay at home if you're feeling sick. How do we cover our cough and our sneezes? Cover your mouth and your nose with a tissue when you cough or sneeze, or use the inside of your elbow, such as this. Please throw away the tissue in the trash, and then immediately wash your hands with soap and water for at least 20 seconds. The 20 seconds is very important. If soap and water, again, is not available, please make sure that you're using a hand sanitizer that contains at least 60% alcohol. Wearing a face mask if you're sick. If you're sick and you have to go out into the public, and or if you are in close contact, meaning riding in a vehicle with someone, sharing a room, the CDC asks that you wear a face mask to prevent the spread of the virus. If you're not sick, you do not have to wear a face mask unless you are caring for someone who is sick and that they are not able to wear a face mask. And we know that face masks are in short supply, so at the end of this presentation, I'm just going to give you a quick demonstration of how you can make your own face mask without having to worry about spending a lot of money. Clean and disinfect. Please make sure that you are cleaning and disinfecting frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, etc. If the surfaces are dirty, use a detergent or soap water prior to disinfecting. So you can use Lysol wipes, Clorox wipes if you're able to find those items. If not, then making sure that you're using soap and water to clean. In addition, the CDC recommends that you make your own solution if you're unable to find some of these items that are in short supply, such as making a bleach solution. 5 tablespoons or 1/3 cup of bleach per gallon of water, or 4 tablespoons of bleach per quart of water. And then follow the manufacturer's instructions for application and proper ventilation. You may also substitute by using an alcohol solution, but just ensure that if you're using an alcohol solution, that it has at least 70% alcohol. So those are just some tips and some recommendations from the CDC in reference to the coronavirus. So I'm going to demonstrate briefly on how you can, if you are not able to come in contact with masks due to the short supply of them, I'm just going to demonstrate very briefly how you can make your own mask at home right quick. And these are items that you'll need: paper towel, a stapler, and rubber bands. And you'll take the paper towel and you'll just fold it evenly like you're making a fan. And again, very inexpensive if you're just in dire need of a mask.
Or, Ms. Walker, some people just want to have a mask to protect themselves and to protect themselves from others. So this will also be an inexpensive way to accomplish that as well, correct?
Correct. Very inexpensive. Again, just paper towels, stapler, and rubber bands. So this is the paper towel, and it's been folded evenly. And then you will bend each side with a small fold. You take your rubber band and place it at the end of the fold. Staple to hold your rubber band. Repeat that step. Staple. Then you'll place the rubber bands behind your ear. And then you'll pull the paper towels apart.
Wow.
So this is just a quick, easy, and very inexpensive way
Wow, good job.
if you're in dire need of a mask.
So
Thank
somebody
you.
say, a social worker? Wow, we learn it, we do it all. Because again, the safety of our children come first. And again, it's not just about our children. Families, you can do this at home as well. Please share this valuable lesson and this demonstration with those who may not be able to see it. Quick and inexpensive way to make a face mask. And now, next, a social worker, Ms. Quentina Rouse, who not only works with our school district, but she also serves as a liaison between us and the front porch. So I'm going to pass the mic to her now, and she'll let you all know about some other valuable resources that are available to our families. Ms. Rouse.
Good morning, families. I want to just kind of give you a little bit of information about the front porch, which is located at 2203 Abercorn Street. This is the baby of the juvenile court probation judges out at Carl Griffin Drive. They felt a need that there was a resource that was needed for our youth who did not necessarily need to be involved with the court system. So they went and did some research, went to Las Vegas, where there's an agency entitled the Harbor. Once they went and checked out the harbor, they said, this is a resource that we could use here, definitely, in Savannah, Chatham County. So the idea of the front porch is to have those students and their families represented not by the court system or the penal system, but to provide resources for those families as well. If you have a student that is running away, just having some behavioral problems, while we were in school, we were looking at truancy issues, but with this pandemic that is going on now, with the COVID-19, I know we have stressful issues. We are parents at home trying to teach our kids. So it's a time right now. So in order to provide some additional support for that student as well as the family, that's where the front porch comes in. So like I said, we have agencies such as Gateway that's involved, the Chatham County Juvenile Court, we have the DA's office, we have the Safety Net Planning, we have Coastal Georgia Indicators Coalition, we have the Mediation Center, we have the City of Savannah that's working with us, as well, you know, we have all of the school social workers that provide resources and input with that agency as well. The front porch, again, is located at 2203 Abercorn. It used to be the old clinic building, teen clinic building. It's right there on the corner of Abercorn and 38th Street. Because of the pandemic right now, you must call to make an appointment. We used to have walk-in visits, but you must call to have an appointment. And that number again is 912-652-6555. That number again for the front porch is 912-652-6555.
Thank you, Ms. Rouse. And the Savannah Chatham County Public School System is certainly glad to be one of the partners working with the front porch. And it goes way back because we the school district, actually went on some visits when we were exploring this opportunity of bringing this front porch idea to the city of Savannah. Your current superintendent of school, your current board president, myself, we all made some visits trying to bring this idea of a one-stop shop for families to our community. So we, the Savannah Chatham County Public School System, are just excited that we are a part of this, again, because it's for our children, it's for our community, and so we're doing our part to try and make a difference. So families, while you're home, you're there with your lovely babies, there may be some times where there's a little anxiety on behalf of the parents or the students. So we have one of our other school social workers, Ms. Majoni, to tell you some things that you can do at home to relieve some of that anxiety and perhaps even some stress. So I'll pass the mic now to Ms. Majoni. Penny, take it away.
Thank you, Dr. Fields. So I'm going to talk to you today a little bit about talking to your kids, handling the anxieties that come along with these strange and unusual times that we're living in. So I think it's real important that we just start out by acknowledging that these are uncharted waters. We've never had a pandemic before. Most of us don't know what to expect. Things change on a daily basis. And I think it's really important that we just acknowledge that being scared, being anxious, whether we're adults or whether we're seeing it in our children, are absolutely normal and reasonable feelings to have during these extremely uncertain times when things change on a daily basis. So I wanted to talk with you about some tips that I found on a really wonderful website called Behavior Flip. It was written by a school social worker in New York City named Nicole Vidri Silva. And so here's just some general tips to help reduce some anxiety. You want to allow children to share their fears about the coronavirus and have age-appropriate discussions. It's really important when your children are talking to you that you stay calm. Whether, even if you're having feelings of anxiety, it's important that when you're talking with them, that you have a calm demeanor and that you show them that you're really listening to what they're saying and encourage them to ask questions. And it's okay if you don't have answers. And you can tell them that because we don't have a lot of answers to a lot of things right now. Make sure the information that you're giving them is appropriate for their age. It's very hard. It's a very different conversation to explain what we're doing and social distancing to a 3-year-old than explaining it to a 13-year-old. It's hard, but we really want to try to limit how much exposure to the media, whether it be social media, television, or radio, that we're taking in about the virus. And when we do take in information, we need to make sure that we're educating ourselves and our children to be making sure they're taking information from credible sources. Social media, while it's wonderful and does a lot of good things, it's not always the place that you want to get all of the most accurate information. So make sure we're teaching ourselves, make sure we as adults are being good consumers and we're teaching our children to be good consumers as well. As hard as it is, and I say this as a mother of 3 children myself, it's really important to limit the screen time. And that's for a number of reasons. But one, because we are at home more, and it's not good to stay inside all the time when you're home. You need to get outside, you need to be active. But we know that the more that our children are on screens, the higher rate of anxiety that they have. So it's important to disconnect. Even just for a couple of hours a day, we need to disconnect. If they are on the screens, it's important that we're using them for educational purposes when we can. And if we are going to use them for social purposes, encourage them to use things like FaceTime or Zoom meetings to interact with their friends. Because even though we all like to text, and that's a lot easier, that face-to-face connection, seeing somebody's face, is important and helping us maintain those social connections during this time. And is a lot healthier way to do it versus just texting or posting on Instagram and things like that. So now let's talk about a little bit about what to do while the schools are closed. The teachers are working hard. They're sending electronic lesson plans. They've put out the choice boards. And it's really important that we are supportive of our teachers and our students during this time. And, it's going to be our new normal for a little while. And so one of the things we need to do is to try to have a positive attitude about it. Try to find the bright spots. We're learning new technology. We get the opportunities to interact with people in different ways. We get to learn new skills. Try to find the positive. If we have a positive attitude about it, our students will have a positive attitude about it. Try to establish a schedule. Whatever schedule makes sense for your family. It doesn't have to be extremely rigid, but try to have some order to your day. It's good for your mental health, and it's good for your students' mental health as well. Encourage your children to have inputs on the schedule. So maybe they would rather start their day at 9 o'clock instead of 8:30. Have a discussion. The more buy-in they have to the schedule, the more likely they will be to want to follow it. Try to incorporate some wellness every day. So that means get outside, take a walk, do some exercise, try to eat healthy. I know it's hard, but do what you can to try to keep your physical body in shape too. This is a great time to have family bike rides if you have the ability to do so. Take family walks around the neighborhood. Do things together. The more active we are, it's not only good for our physical health, it's good for our mental health too. Finally, try to get creative. We have the opportunity now to have a little more time to do some things that we wouldn't normally do. So maybe taking walks isn't your thing, but maybe having a family dance party is. It's a good time to have a little fun and do some of those things and reconnect in ways that you haven't been able to before. My kids love playing board games, so we're able to play board games more now than we ever have before. Maybe your family loves to play Uno. Maybe you're going to have some Uno championships. Think of ways to be creative, incorporate some together time, but also some ways to, to kind of stay active and be connected. Finally, one way that we can help our children deal with these times is help them find ways to help other people. We all are having different struggles at this time. Some people are struggling with loss of employment. Some people are struggling with, lack of food resources. Help your children look for ways to help others. When we help each other, then it gives us a sense of meaning and purpose, and it helps our mental health as well. And there's lots of ways that we can do that and maintain social distancing. There's lots of opportunities to raise funds. There's lots of opportunities to donate things. Even if it's just, sending cards to the workers in the hospital, there's lots of ways, and the internet has lots of really great resources to help you figure out ways that you can have your students help others. So the final thing I want to say is that if we as adults practice good self-care, then we are better able to help take care of our children. As I said when I started, these are unprecedented times. There is no rule book. None of us really know what to expect from day to day. So we have to do the things that help us individually find peace and help us to maintain a good spirit and reduce our own anxiety. So you can't help others if you aren't taking care of yourself. So I encourage all of you as adults to take good care of yourself. Go to the things that help you stay strong and have good mental health, whether that be exercise or, prayer or meditation, whatever it is. Do those things on a daily basis so that you keep your tank full, so to speak, so that you're able to love on your children and be supportive for them during these challenging times. So with that said, I wish you all the best. Stay well, and I'll turn it back over to Dr. Fields.
Thank you, Ms. Majoni. So again, as we go through these unprecedented times, conditions that we've never seen before and we never hope to experience again, a lot of uncertainties out there, but there is one thing that is certain. That is that we, the Savannah-Chatham County Public School System, we care about our students, we care about our family. We are a part of this community, and we are here to do all that we can do to remove that anxiety, remove any barriers that will prohibit our children from becoming successful. So that is certain that we are here for you. This information today has been provided on behalf of the Student Affairs Department. We do our best work when we collaborate, because when we collaborate, then we are able to celebrate. Our motto is, together we can. So we want to do it in tandem with all of our community service agencies and those in our even surrounding counties. So please don't hesitate to call us. As we said when we started, our doors may be closed, but our ears are open. We are open to you to do whatever we can to help our young people be successful academically, behaviorally, socially, and emotionally. If you have any needs, please do not hesitate to call us, 912-395-5584. Again, that number is 912-395-5584, Student Affairs Department. Thank you.